Keratosis pilaris, goose flesh, KP, strawberry skin. Whatever you want to call it, keratosis pilaris is one of the most common, but it's a very frustrating condition to deal with. I'm Dr. Dustin Portela. I'm a board-certified dermatologist practicing in Boise, Idaho, and today we're going to talk about keratosis pilaris. You may have it or know somebody who does, and if you do, you know that it's really hard to treat. So here's my top tips to treat keratosis pilaris from home. First off, what is keratosis pilaris? Keratosis pilaris often looks like this. What we have happening is it's called a retention of keratin. Keratin is the stuff that your skin cells are made out of, and your dead skin cells are largely keratin, and they build up around the opening of the hair follicles. On the backs of the arms is the most common location, but it can happen on the thighs and even on the sides of the face in some instances. Usually the skin has a texture to it. It feels rough and bumpy, or that's why we call it goose flesh sometimes. It can also be red, which gives it the name strawberry skin, and that red and bumpy, rough appearance is what really becomes bothersome to some people. But it's important to know that this is really just a normal variant of skin. It's very common, and for most people it's asymptomatic, meaning it doesn't cause any symptoms. It's rarely itchy. If you have eczema or dry skin, you're more likely to notice this, and it can improve if you're really good about hydrating the skin, but sometimes using a moisturizer isn't enough. First, let's talk some of my favorite over-the-counter treatments. These are largely going to be creams, lotions, or body washes that have ingredients like alpha-hydroxy acids, beta-hydroxy acids, or polyhydroxy acids. The reason is that these can help to dissolve some of those dead skin cells and gently exfoliate them. Exfoliation means the removal of dead skin cells. It's very tempting to get aggressive with your exfoliation, but that's likely to cause more harm than good. In addition to chemical exfoliants, you can do physical exfoliants. Physical exfoliants are things that are mildly abrasive on the skin. This is a Clean Logic body scrub pad. I love Clean Logic products. They're really good for physical exfoliation without being too aggressive. So you can use something like this with any body wash that you want in the shower, and it will help to lather it, and it gently exfoliates as you scrub on the skin. It's important not to be too aggressive when you do that. Let the tool do the work. You don't need to press really hard. Something like this is not intended to be used like sandpaper. It's just gently exfoliating the top layer of dead skin cells. That will in time help to smooth keratosis pilaris a bit, but it's not likely to cure it and make it go away permanently. If we jump back to the chemical exfoliants, let's look at a few of the lotions or creams or scrubs that I recommend to my patients and that you can get over the counter. First up is the Resurface Plus line from SkinFix. This has 7% glycolic acid and 6% lactic acid, and it's intended to be used as a pre-shower scrub. The idea is that you take this and you rub it on the area where you have keratosis pilaris, and you put that on the body before you jump in the shower. So you can get it on, rub it, it's got a little bit of a gritty texture to it without being too aggressive, and then the acids will go to work and help to soften up some of that dead skin cells. Then you jump in the shower and you can rinse it all off. After you get out of the shower, the second step is to apply the AHA renewing cream with 5% alpha hydroxy acids to damp skin. When you apply the moisturizer to damp skin, it helps to hold on to that water and moisten, soften, and hydrate the top layer of dead skin cells so that you get a more smooth texture. I've tested out the SkinFix products and I found them to be pretty gentle while also being effective, and just know that no matter what you do with keratosis pilaris, you're likely to still see some evidence of it, whether that's a little bit of texture or a little bit of redness. There's many companies that make lotions and creams that you can use to treat keratosis pilaris. Another one is First Aid Beauty. The smoothing body lotion contains 10% alpha hydroxy acids, and again, it's best to apply that when you first step out of the shower when your skin is still a little bit damp. Don't dry off completely. When you start to apply these types of creams, you want to make sure that you're not causing irritation. So if you feel like repeated use, daily use is causing burning, stinging, or irritation, then back off and don't use them every day. It's okay to use them only 2 to 3 times a week. And then on the other days, you can apply just a gentle cream-based moisturizer. And I've talked on other social media channels about some of my favorites, things like CeraVe cream, Cetaphil cream, and Vana cream, among many others that are just good, hydrating creams that contain things like helpful ceramides flavonoids or lipids to help hydrate the skin and to repair your moisture barrier, because you don't want to take all this exfoliation and then try to get rid of the dead skin cells and also completely disrupt your moisture barrier, because that's going to end up exacerbating the problem. KP Duty makes a lot of different products. We're going to take a look at a few of them. Again, the similar concept here is you're going to want to apply these to damp skin when you get out of the shower. The KP Duty kit comes with a body scrub, and just like Skin Fix, you want to apply this to your skin and then leave it on for a little while before you rinse it off in the shower. And just like Skin Fix, it comes with a moisturizer that you apply on damp skin after you're out of the shower. Then make another big tub of a different type of body scrub, and same principle, you're going to put this on and then rinse it off. These are not often recommended for use on the face. Your facial skin is going to be a little bit more sensitive, so using these products frequently there could risk irritation. Another important point when using a lot of these creams is alpha hydroxy acids are chemical exfoliants, and they will gently remove some of that top layer of dead skin cells. In dermatology, we call that the stratum corneum, but that can increase your risk for sunburn. So you do want to make sure that you're using sunscreen every day when you go out, particularly there on the backs of your arms or on your face or your thighs, wherever you're using these types of products, or more gentle products, of course, if it's on the face. But sunscreen's always important for almost any skin condition. I'm not a huge fan of the graphics on KP Duty, but I think they're saying like chicken skin with this. Not my favorite images, but they're good products, so these are definitely something you can use. Now, over the counter, there's a lot of other options. As I've already mentioned, there's things like salicylic acid, and you can get that in CeraVe. It makes a nice CeraVe SA cream, and that's something that could definitely help with keratosis pilaris. You want to apply that again to damp skin when you get out of the shower. I hope you're getting the message on that. In general, if you're using any of these chemical exfoliants, you want to just stick with those. I wouldn't do chemical and physical exfoliation at the same time. So don't like get this body scrub from one of these companies and then take your scrubbing pad and like go to town. You're going to really mess things up if you do that. You don't want to disrupt your moisture barrier. You don't want to cause more dryness when you're trying to fix dry and bumpy skin. Now, what if you've done all of these kinds of things and you still have like really rough and bumpy skin, or is really, really red? Are there things you can do? And the answer is, of course, yes. This is where you probably want to go see a board-certified dermatologist. And that's really the story for lots of different skin conditions. If you're treating it over the counter and it's not getting better, go see a dermatologist, because you might need prescription therapy. Now, I'll be honest, the prescriptions that we prescribe for keratosis pilaris, they're not going to cure you either. Most of the time, if you have keratosis pilaris, we can improve the texture and improve the color to a degree, but we really see that most people will grow out of it with time. And I say most people because not everybody does. If you have a lot of redness, or the skin is so dry that you're itching really bad with your keratosis pilaris, we can prescribe topical steroids, and you really should follow the directions of a dermatologist on how to use those. So you don't want to use them too much, because again, almost anything can have side effects, and you don't want to cause a new problem while you're trying to fix something that really for most people is asymptomatic and not problematic. Sometimes there's a case to be made for using things like tretinoin or a retinol. Now, that can also break down your moisture barrier and cause irritation, so you do want to be careful. If I've ever prescribed tretinoin, a lot of times, and this is just my personal preference, if you're getting a prescription, you really need to follow the directions of your dermatologist. But I'll have patients mix it with a moisturizer to kind of dilute it a little bit, because a lot of the retinoids are, they're made for facial skin, which is in some ways more sensitive, but in some ways more resilient depending on the treatment that you're doing. And so it can cause a lot of dryness on the body. So it's okay to put that on and then put a moisturizer on. But the retinol, again, helps to thin out the stratum corneum. That's the top layer of dead skin cells. So that's a treatment approach that can sometimes be undertaken. And there's not a lot of data on the use of lasers, but some people will use that to help get rid of some of the redness. Depending on the wavelength of the laser, you can help to target some of that redness, some of that inflammation in the skin. So again, let's recap. Keratosis pilaris is a really common skin condition, and if you have it or you're bothered by it, you're not that atypical. It's normal, and most of the time these things bother you more than they bother other people. Most people don't notice it. There's lots of over-the-counter methods to try to treat it, and I recommend the gentle use of body scrubs, physical exfoliating pads like the Clean Logic line of products, and then to moisturize when you get out of the shower or the bath, whether you're using an AHA, PHA, body moisturizer, or even just a regular cream-based moisturizer that's good for your moisture barrier. You can't go wrong. Just put it on damp skin and you'll gently see that the texture improves. Then also know that keratosis pilaris is something that most people will grow out of, so Try to be patient and do what you can from an over-the-counter perspective. Visit a dermatologist if you need to, and you'll slowly, hopefully, see some improvement. I hope this has been helpful. Again, I'm Dr. Dustin Portela, board-certified dermatologist. If you have questions about keratosis pilaris, make sure to put them in the comments below. And if there's other topics you want to see, make sure to leave a message and let me know what you want to learn about. I'll try to answer your questions. I know it's hard to get in to see a dermatologist sometimes, so if I can be helpful to you in your skincare journey, let me know and I'll try to cover your particular topics in future videos. Thanks for watching. Make sure to hit that subscribe button and the alert notification so you know when new videos are coming up. I try to release videos every Tuesday and Thursday, so I look forward to seeing you back next time.